Tonight, I'm going to be giving a speech on sleep apnea. Um, my co-worker always came to work feeling tired, exhausted, and almost non-productive on a daily basis. On one occasion, she almost lost her job when she was caught sleeping in the break room while still on the company's clock. Since she was such a great person who I got along with very well, I decided to have a talk with her about her sleeping habits and to see if there was anything I could do to help. That was when she told me that she couldn't get. That was when she told me that she's been diagnosed of sleep apnea. Though it may appear that she sleeps at night, she actually wasn't getting the amount of sleep that she needed due to the constant interruption that kept waking her up. In essence, she could actually be on the bed for 8 hours but only getting like 4 hours sleep. That explained why she was always so tired during the day, because her body wasn't getting the amount of rest it required. Sleep apnea is a condition that could interrupt our normal functioning and prevent us from enjoying life and from doing the things that we love to do most. It is the inability of the body to get proper amount of oxygen to the lungs during sleep. This condition, as explained by an online article, is a chronic disorder in which one repeatedly stops breathing during the night. According to an online article titled Understanding the Causes of Sleep Apnea and Factors That Increase Your Risk, obstructive sleep apnea occurs as a result of bone deformities or enlarged tissues in your nose, mouth, or throat. Other causes include drinking of alcohol, which affects the part of the brain that controls breathing, taking some medicines for conditions such as long-term pain, insomnia, or anxiety. These medicines could relax the muscles and tissues in the throat, causing it to narrow. Each episode of sleep apnea could last between 10 to 30 seconds. These symptoms of sleep apnea, as described by an online article, include loud chronic snoring, choking or gasping during sleep, waking up with a dry mouth or sore throat, morning headaches, and frequent visits to the bathroom during the night. According to an online article, the effects of sleep apnea could result in high blood pressure, heart failure, diabetes, depression, and worsening ADHD. Though a diagnosis of sleep apnea could be scary, studies show that it is a treatable condition. There are things you could do on your own to minimize the incidence of sleep apnea. Such things, life changes include weight loss, quit smoking, avoid alcohol and caffeine, and avoid heavy meals at bedtime. Maintaining regular sleep hours. Now, I'm going to show you some slides of people suffering from the condition of sleep apnea. Excuse me. I have slideshows of pictures. Okay. Yeah, I'm going to need to show you guys pictures of people who have that sleeping disorder called sleep apnea. Here is one of them. Yeah, people with sleep apnea always feel so tired during the day because they actually don't get the, amount of sleep that they are required to get at night. They could be on the bed for 8 hours, but actually they're getting like 4 hours sleep. So when you see them in the daytime, they are walking and sleeping, you know, they're at work, they cannot concentrate because they're so tired, because all through the night, the interruption of breath, that keep waking them up without them knowing, makes them not to get that amount of sleep that they are supposed to get. Look at, they sleep anywhere, they can sleep, they can be actually walking and sleeping, they can be sitting down and sleeping while you're talking to them. So these are some of the conditions, symptoms that you get when you have cases of sleep apnea.
Anybody ask any question?
So, does anybody have any question for me?
Yes. I got a question.
What do you have?
My question is, you talked about sleep apnea, apnea, whatever the name might be. So, my question is this: do they have is it treatable, or do you have to go through some therapy
Yes,
to take care of
it
that?
is a treatable condition. Studies show that it's treatable. But you have to make major life changes. Like you have to quit smoking. You have to, minimize the amount of alcohol and caffeine you consume. And you have to avoid eating heavy meals before going to bed. Because when you eat so heavy and you go to sleep at night, this could be one of the major factors that that would present a situation like sleep apnea.
What about people that they are not smokers, they are drinkers, and their lifestyle is very very good, and don't they have some people that even with all of this, they still have this sleep apnea? So what do they have to do? The people that they don't smoke, they don't drink, they live, they exercise, they walk.
Yeah.
But yeah, they still have this problem.
Hereditary. Yeah, that could be hereditary too. In a situation like that, we could term it as hereditary. Like if you don't smoke and you don't drink and you're not overweight, the only possible explanation you can have for cases like that is
But is it treatable?
Yeah, it's a treatable condition. Yes, it is a treatable condition, definitely.
Okay, I have another question. Like this hereditary condition, situation, and these people doesn't have this factor